School says it's 7 o'clock. Thank you for coming. Let's bring the meeting to order with pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you for coming tonight. And Happy New Year. Our agenda is before you, or was before you if you looked at it. If you have any public comments on the agenda items, now is the opportunity for that. Any public? Yes.
I'm sorry, where's the agenda?
There should be one out there on the table.
On the table is
Right
one,
outside
yeah.
the door there.
It's on the blue sheet.
If you want to look at unfinished business and new business there, that would be the things on the agenda for today. If there's no public comment on agenda items, we'll move on to the minutes from last meeting. Any comments, any corrections?
I move that we approve the minutes as presented.
It's been moved to approve the minutes as presented
Second.
and seconded. All in favor?
Aye.
Aye.
Opposed? Treasurer's report is presented.
I move that we approve the treasurer's report as presented.
I'll second that.
It's moved and seconded that we accept the treasurer's report as presented. All in favor?
Aye. Aye.
Opposed? Claims and payroll.
Make a motion that we accept claims to payroll as presented.
I'll second that.
Moved and seconded that we accept claims and payroll as presented. All in favor?
Aye. Aye.
I'm sorry.
And there is no judge's report yet for December. Move on to the mayor's report. And that is December's. So that's old news.
You want that one?
We'll do January. So we have signed a contract with Vaughn Construction for the Blake Street and Johnson Street construction. We put out bids and Vaughn came back actually with the only bid because they're local and do the particular type of road construction that we're looking at. We're looking at doing that similar type of paving that they did out on the airport road. If you're familiar with that, Vaughn has been working on that road construction method, which is kind of a new method that seems to work pretty good and be about a third less the price. So we'll see how that works on Johnson and Blake. The North Well House construction will begin next spring, and that'll be Morris and Merrilee taking care of the engineering on that. Also, the Vaughn construction on the roads, that'll start in the spring as soon as the weather is amenable. We did hire a new public works employee on the 20th of December, Matthew Burse. So he's been working with us here for about a week and a half and shows good promise. He's been really helpful. It's good to have him on board. There will be a public hearing on the Llewellyn Street subdivision on January the 23rd at 7 p.m. here at Town Hall. So anybody interested in that, that's been noticed to all of the adjacent properties and to the town. So anybody that has comments on that, that would be the time to present those comments.
What time is that at?
It's at 7 o'clock on the 23rd, and it'll be here in the council chamber. There will also be a planning committee meeting at 6:30 on Friday here. So if you have questions or thoughts about that, you can come and kind of listen to that too. Anybody is invited to that. The public's invited. The renovation of the city fire hall is underway. The first phase is almost done. They've repaired the sheetrock, and I believe they're just about ready to paint. There's 2 more phases that we're looking at. The next phase will be moving into that bay that hasn't been used for a while, right behind the main bay for the fire hall. They'll be breaking into that and making that a space for turnout gear and an office, a new chief's office. What we're going to do there, those of you that don't know, is kind of divide the fire hall. Right now, the fire hall meets, their training room is behind the public works bays. So we're going to move them over into that other bay, and then with hopefully a third phase, we'll build out, frame in a larger area for their meeting out behind the present fire hall bay. So we're kind of looking at the financing for that, and we'll be able to do at least the first and second phases. The second phase will probably start in about a week. They're making good progress. On the third phase, the hope is to put in a bathroom over there so they don't have to go into the public works bay to use the bathroom there, and to give them some room for their meetings. I'm trying to think if there. Oh, I should mention too that the city picked up a gravel spreader or sand spreader last week. We picked it up used, and the guys have gone through it, and it's up and running now. We're hoping this year to maybe use less of the magnesium, which is terribly corrosive. We'll still use it when we need, particularly like in intersections, when the weather is appropriate for it. If it's not too cold, it makes a good mitigation for skidding, but we're going to try to use more sand, and that way we can sweep that up in the springtime, and it should be less corrosive for the vehicles. That's all I have for the mayor's report. Any of those things you can come to my office and talk to me too if you have any questions about any of that. Officers' reports. We have no report from the fire department. Tony isn't here. Police department.
You have friends.
I'm sorry?
No meetings No meetings this past month, is that what you're asking? Oh.
No, for the fire hall, yeah.
I jumped the gun here.
Police department stats. Calls for service for full-time were 25. Arrests made were 4. Criminal and traffic citations written and warnings were 115. Citizen contacts were 6. Business bar checks were 8. Resident checks were 18. Other agency assistance was 15. And paid reserve officers were 3 this last month. Public Works Department, we don't have any report from them, but I've kind of shared some of that with the mayor's report. So we can move on to unfinished business, ordinance on restricting certain businesses. So we have an ordinance that we're working on. It's before our attorney right now. a decency ordinance that would restrict any business that profits on pornographic type of or illicit type of material. And because of freedom of speech, obviously we can't prohibit all of that, but what we can do is put restrictions on the distance that is from certain public facilities such as churches or city hall or businesses or certain residents. So that's and I think all of the council has a copy of the rough of that. As soon as we get the copy back from our attorney who's gone over that, we'll get a copy of that in your hands, and hopefully by next month we can do our first read of that ordinance. So go ahead and take that home this month. I think a lot of you have already perused it, but take that home and look it over. And if we have any additions or concerns, now is the time this month to get that taken care of, and the sooner the better, so we can clarify that with our attorney. So.
Joel,
Yes.
Thompson Falls just completed this whole process. Have you contacted them on?
I haven't. A similar ordinance?
Yeah, talked with Randy.
Rusty, you mean?
I'm sorry, Rusty, yeah. Yeah, it's probably 6 months ago. They went
Oh, I
through
did not know
the same
that.
thing again.
Well, I guess I didn't
Hey.
talk about that kind of thing, but that would be a good, yeah, I'll give Rusty a call.
Thank you. So you can put that in the paper, but you can't put his speaking out of turn in the paper.
And
On that roll now.
no gloating over Thompson Falls being ahead of us once again. Yeah.
But I'm glad we're doing it.
Yeah.
It's timely.
If there's no immediate discussion or concerns about that, we'll move on to new business. Our only new business this month is to appoint a couple of new faces to actually not new faces, one new face to the planning board, and that would be John Dossett. For our planning board, we have 7 members. One of those members is to be a council member, and John Dossett has volunteered for that. So, yeah, unless anybody else wants to interject and jump into that position, speak now or forever hold your peace.
Plan away, friend, plan away.
I would take a motion to accept the appointment of John Dossett to the planning board.
I move that we approve John Dossett to the planning board.
I'll second that.
Moved and seconded to approve John Dossett for the planning board. All in favor?
Aye.
Aye.
Any opposed?
Congratulations.
Yes. Thank you for not opposing yourself. And the other is actually on the planning board now, but she has volunteered for another role, another term. Vicki Evans has volunteered to sit on the planning board for another 2 years, which would take her to December 31st, 2026. And I would recommend her appointment. Does anybody want to make a motion for Vicki Evans?
Okay, I'll move that we approve Vicki Evans for the planning board. I was waiting for John to jump in.
Oh, good.
I was holding my tongue.
I'll second it.
Moved and seconded that we approve Vicki Evans for appointment for another term to the planning board. All in favor?
Aye.
Aye.
Any opposed? All right, we will send her a letter. And we are really leaning heavily on that planning board here as we're working on that subdivision next month. So they're doing a lot of work, a lot of volunteer work. Appreciate the work they're doing.
What are the terms?
They're a 2-year term.
2 year.
Yeah. Committee reports, no administration committee yet. Somebody's got a cold, I think. Public Works Committee, and I did talk to Chad earlier, and Chad says we did not have a meeting. We do have a meeting coming up, but there's no comment on the Public Works, right, Chad?
Correct.
Okay. Parks and Recreation. And our Parks and Recreation chair isn't here. Not exactly the right time of year.
No.
Becky.
Oh,
Is that, yeah.
Yeah.
Planning Board. No report from the Planning Board, but be at those meetings if you can. Police Commission.
That's my turn now. We had no meeting, we'll probably try it for one this month.
Okay. Police Commission hoping to meet this month. Safety Committee meeting is attached. We did have a Safety Committee meeting. Last month, Tony led that. And yeah, you have those minutes before you. Present were Tony Young, Public Works Director Greg Dickin, myself, Brad Kinsey, and Kathy Emmett.
I did have a question.
Yes.
How exciting that we have a public works director. When did that transition happen?
Well, we actually,
Yeah.
that was kind of a misnomer. But that is something that we are looking at, and that'll be discussed. Yeah, that'll be discussed at the Public Works Committee.
Do we need
Meeting.
to have a conversation about this?
Yeah. Were you volunteering for the job?
No.
Okay.
Great to have one though, right? To
Yeah.
take some of that pressure off of you.
Yeah.
Just another public
We're
works director.
working on that. That's going to go to the Public Works Committee as to assign a director. Yeah. So that kind of covers our business. Is there any public comment about anything or on the agenda or off? Yes, could you come up and introduce yourself? And I don't even know, is that mic working?
No, none of the
Okay.
lights
Can you
work.
hear me?
We can
No.
hear you.
Okay. I'm Nicolette Butler. I'm a resident of Paradise, and I'm a RN at the hospital in the emergency room. I'm just curious, we have a lot of transfers without ALS providers and our staff there at the hospital. I'm just curious, is there anything as a community or like a paid position, something that's promoted because it's really tough on our patients. And so I just was curious about that. I just moved here in September.
Yeah,
Welcome.
thank you. And it was Nicole?
Nicolette.
Nicolette?
Yes, sir.
Yeah, thank you, Nicolette. I can just speak to that for a second. Mostly that's something that Plains Ambulance is certainly trying to alleviate the complications with that as much. We do have a number of paramedics. I think right now we have 3 paramedics, and then an advanced EMT. But even that, with a volunteer service, it's been pretty hard in a place like this to bring somebody in. But it is a concern, and it's been nice that the hospital is able to send an RN for some of those ALSs. I know it's a strain on the hospital, but it's also a strain on the ambulance service too. But it is a concern in I think all of these small Montana communities right now.
Are there
You-
grants out there that help cover things like that?
Say again?
Are there grants out there that help cover positions like that to entice someone to come in?
Well, the difficulty is there's no full-time position. you know. So what they typically do is if there's not a paramedic that's available, they'll see if there's a nurse that can go on that ALS transport. And if that doesn't work, then we have to bring in from either Superior or Polson or
Yeah.
another service.
I was just see if there's like a grant that would cover one that would kind of help Thompson Falls, Hot Springs, like the whole community, and would need. But you know, I don't.
Yeah.
You know,
Well, and the difficulty is that that person will also work shift work. You know, they can't be available.
all the time.
Yeah.
Or maybe a grant that pays for a fund to cover somebody in that position when they're not working. Yeah, that would be really difficult too.
Yeah. Seth Gibbs, you know, is the president of Plains Community Ambulance, is always kind of working on that too. And you've probably connected with him on it, Nicolette?
No, sir.
Okay.
I wasn't really sure. I just, I feel like this is where I'm going to plant some roots, and so I'll probably be at the hospital for time to come. And I just notice it's a big stress on the providers. I did a lot of travel nursing around the country, and at a lot of the facilities that receive from places like this. But I just know it's been, we've just had a lot of cases lately in the last 3 to 4 weeks, particularly that, I mean, really, you know, probably deteriorate the patient's outcomes because we just couldn't get a provider, and we tried all the communities, and it's hours and hours and hours. So even, you know, and then there's concerns, because I do know there's providers or people involved in the hospital, there's laws, you know, they can't financially contribute because it's illegal for them, you know, even if they want to buy something or contribute in a way that we could pay ALS providers to do like on-call transfers or things like that, you know, be on call for 12 hours, and if you go, you get paid this, you know, by the city or by whoever, we don't know. But just because, you know, it's hard to work 12-hour shifts anyways, as all the EMS providers know and the nurses and the doctors know, but it's also like in a small community like this, like, you know when someone's not here at your board meeting or whatever. So, you know, it's a small community, and I just see it's a big need, and I know there's grant money, I know there's stuff. So, you know, kind of like your member was saying, you know, there's a bucket of money that we could just do per hour if there's a call, if there's a need, if we can't get some of the communities or whatever to do that we could pay for a class or pay for a payment, something that we could make our community be able to benefit from, you know, those funds, because that's a problem, you know.
Yeah.
That's a problem in the community. So
Yeah. No. Understood. That's something. Go ahead and keep, you know, since you're in the medical field, keep your eyes open for any grant opportunities like that, and take them to Seth. I know that they've got their feelers out for that all the time. They do have an EMT class that will be starting, I believe, the end of January, and that's typically been our source for EMS, is to have a class pretty much every year in the last 4 years, I think. To at least get them started in the EMT. Also, any grant monies that might help pay for the paramedic classes. The closest is like in Polson, but things like that are a good community concern. Ongoing. Thank you for bringing that up.
An ALS transfer would be like from Plains to Missoula or something?
Well,
like that?
or a BLS, Advanced Life Support, ALS, is where you actually need somebody that can push meds or push fluids, other than saline. So you need to have a higher level of training on that, like a paramedic, or in some cases, an advanced EMT can do that. If we don't have an advanced EMT or a paramedic, then we have to take along an RN in order to do that.
So, in my job at Council on Aging, and I've been trying to get more grant money and everything. So, Montana is one of 11 states that's considered underfunded through Health and Human Services. We get 1/10 of 1% of the Health and Human Services federal budget in this state. Most of it goes to food stamps or Medicaid. What little bit is left is what gets filtered out to all the other programs for health and human services. And so we get people here from out of state and they say, well, I need to sign up for this program and this program, and we've never heard of them.
They don't exist here.
We don't have any of those programs or funding for them. So when you get 1/10 of 1%, it doesn't go very far when you've got Medicaid and food stamps to fund.
Right. That's a good statistic to make us a prime recipient of any grants that are out
That's
there,
based on
though.
population. So we're in the bottom 11 of the states for population.
Yeah. And with the transports, that's a crucial thing because we're 75 miles from hospitals that can provide higher care. So, yeah, it's an ongoing concern. Not a lot that we can do as a town hall, but something that we can do as a community. We did help provide an ambulance for that purpose, for transport for them, which they're using. So.
How often does this happen? Per week or
I'm gonna
3 times or?
I'm gonna spitball and say more like there's about an even amount of BLS and ALS. There seems to be more ALS than there used to be, but and a BLS is a basic life support where an EMT can cover that, and we do have more EMTs than paramedics, so usually we're able to take those. I'm going to say that even split, you're still probably looking at anywhere from, it might only be 2 a week to sometimes it can be up to 7 a week. The ambulance, I believe, broke 600 calls this last year. So that's, if you figure it about average 2 calls a day, that's between transports and emergency or 911 calls. And there's about an even split there too. We do about as many 911 calls as we do transports, patient transfers. Yeah, so that's come up over the years since I've worked with them. I think when I first started working, it was more like 400. But we do have kind of a community that's more geriatric than we used to. We're all getting older.
Yes, you are.
So.
And the young ones are moving away for more money, better housing opportunities.
Yeah. Thanks for bringing that up, though, Nicolette. Is there any other public comment? All right, I would take a motion to adjourn.
Move to adjourn.
Second that.
What would you say?
Moved and seconded. We're adjourned. Thank you guys for being there for us.